What is expiratory versus inspiratory wheezing in COPD? Wheezing sounds can be alarming, especially when they signal a health issue like chronic obstructive pulmonary disease. Understanding the difference between expiratory and inspiratory wheezing can help you identify what is happening in your lungs. Wheezing is a high-pitched, whistling sound that occurs when air flows through narrowed or obstructed airways. In chronic obstructive pulmonary disease, expiratory wheezing is the most common type. This occurs when you breathe out or exhale. During this phase, the small airways in the lungs become narrowed due to inflammation, mucus buildup, and swelling. This narrowing makes it hard for air to flow out, leading to that recognizable wheezing sound. On the other hand, inspiratory wheezing happens when you breathe in or inhale. This type of wheezing is less common in chronic obstructive pulmonary disease. If it does occur, it usually indicates that there is significant narrowing or obstruction higher up in the airway. Inspiratory wheezing can suggest more severe airway involvement and may point to upper airway obstruction. In chronic obstructive pulmonary disease, expiratory wheezing is typically more noticeable. This is because the disease primarily affects the small airways and lung tissue. As a result, the airways can collapse during exhalation, making it difficult to release air from the lungs. Inspiratory wheezing may happen if the airway narrowing is severe enough to affect airflow during inhalation as well. From a clinical viewpoint, the presence of wheezing in individuals with chronic obstructive pulmonary disease indicates more severe airway obstruction. This can be associated with worse symptoms, lower lung function, and a higher risk of flare-ups. Healthcare providers often use wheezing as a marker to assess the severity of the disease and determine if treatment adjustments are necessary. To summarize, expiratory wheezing occurs during exhalation and is common in chronic obstructive pulmonary disease due to small airway obstruction. Inspiratory wheezing occurs during inhalation, is less common, and may indicate more severe airway narrowing or upper airway involvement. Recognizing these types of wheezing can help you understand the extent of airway obstruction in chronic obstructive pulmonary disease and guide clinical management.